and my fellow friends. I represent Group 10 and would like to present the learning issues for our case about dystocia. It is important to note that it should be pronounced as dystocia and not dystocia, which is a common mispronunciation. To put in simple words, dystocia is the difficulty in birth where there is delayed parturition until there needs intervention. An important statistic to look at is that over 35% of calvings in cattle requires assistance due to dystocia, and over 50% of stillbirth cases are due to dystocia. The usual clinical signs of dystocia are the onset of labor without delivery of fetus or fetal membrane, and the later regression of parturition signs. In our case, it was determined that the dystocia is due to fetopelvic disproportion and fetal malposition, where the fetus was quite big and the head was deviated to its left lateral. Anyhow, the calf was found to be alive. Some of the management available for dystocia in this case are through manual reposition of the fetus, manual traction, administration of hormones or drugs, and the surgical procedure, which is Cesarean Section. For manual reposition of the fetus, it can be done by pushing the calf from the pelvic cavity into the uterine cavity to have more space to correct the head posture. Then we can cup the calf's nose and pull it forward to correct the posture. Manual traction can also be done by using chains, obstetrical straps, or rope that is looped around the calf fetlock and half hitched below the fetlock. With the protruding leg of the calf and the cow's vulva area being lubricated, the calf can be pulled using a full body calf strap or a calf puller. Besides manual traction, hormones such as oxytocin can be used to increase the frequency of uterine contraction, and drugs such as calcium borogluconate can be used to treat hypocalcemia. The fourth method would be through a surgical procedure of Cesarean section to deliver the calf through an incision made at the cow's abdomen. In this case, since manual traction failed and the fetus was still alive, C-section was performed to remove the fetus. The surgical approach used for Cesarean section in this dairy cow is the standing left paralumbar fossa ciliotomy. Routine skin preparation of the left flank is performed, and for anesthesia, we can opt for either paravertebral nerve block and the transverse processes of T13, L1, L2, or the local inverted L block at the left flank using 2% lidocaine. After that, a vertical skin incision is made approximately 30 to 40 cm on the middle of the left paralumbar fossa, starting 10 cm below the lumbar transverse processes. The subcutaneous layer is then bluntly dissected. Next, the external and internal abdominal oblique muscles are sharply incised. Next, the transverse abdominal muscle is split vertically by blunt dissection. The peritoneum is tented and incised at the dorsal aspect of the incision using a scalpel, and then the incision is extended vertically with the blunt tip scissors. So now the entry of the abdominal cavity is then obtained. Next, the uterus is identified, and the hind limbs of the fetus are normally located at the tip of the pregnant uterine horn, which is at the lower quadrant of the abdomen, close to the flank incision. So the fetal hind limbs are located, and then the uterus is exteriorized through the incision. An incision is made on the uterus over the greater curvature of the uterus. The allantochorion and the amnion membranes are then ruptured manually. Next, the calf fetlocks are grasped with hands or a sterile obstetrical chain, and the calf is removed from the uterus by pulling it in a cranial and dorsolateral direction through the calf left flank incision. The calf that is just delivered is then attended to by another team to provide necessary neonatal care. The incision of the uterus is then closed with a Utrecht suture pattern by using number 1 PDS or number 1 Vicryl suture and a large round-bodied tapered needle. The uterus is then checked for any tears, and the surface of the uterus is rinsed with a sterile fluid, and the uterus is returned into a normal position within the abdomen. For the closing of the flank incision, firstly the peritoneum and the transverse abdominal muscles are closed together using the number 1 or number 2 Vicryl simple continuous suture pattern. Next, the second layer is closed by incorporating the internal abdominal oblique muscles and the external abdominal oblique muscles, also using the number 1 or number 2 Vicryl simple continuous suture pattern. Lastly, the skin incision is closed with cruciate pattern, simple interrupted horizontal mattress, or fourth interlocking pattern, using number 1 or number 2 nylon and a reverse cutting needle. For the post-operative care of the dam, analgesics such as tramadol, anti-inflammatories such as flunicin meglumine, and antibiotics such as penstrap can be administered to the dam. Besides, wound dressing with antiseptic should also be done daily by using povidone iodine. Wound Cerex can be sprayed around the suture site to prevent insects or flies. and the most important thing is to monitor the progress of wound healing daily. In a normal situation where there is no complication, the suture site should be healed completely in 2 to 3 weeks time. Administration of drugs, especially antibiotics, require a period of withdrawal to reach the maximum residue limit in milks or meat before it can be safely consumed by humans without causing any hazards. Penstrep, which is a combination of penicillin G and streptomycin, requires at least 3 days of withdrawal period, while flunicimaglomin, which is an NSAID, have a withdrawal period which is 4 days. It is also important to know the effects of C-section on reproductive performance of the cow. C-section affects the cow's reproductive performance by having a longer calving interval, particularly the interval from the first cervix to conception, which was 18 days longer for the C-section cattle in one study done. Aside from that, it will also result in a higher breeding index or lower fertility rate. Moreover, in one study done, the cattle which had to undergo C-section produced on average 79.9 liters less milk in the first 100 days of milking compared to the cows with normal delivery. So once the calf is pulled out, one team will be taking care of the calf. Firstly, they need to get the calf into sternal recumbency, then they need to stimulate the calf to breathe. So the nose of the calf must be cleared and make sure no amniotic membranes or fluid block the nose. A dry, clean piece of hay can be used to tickle the nose, or some water can be placed in the calf ears to make it shake its head. Artificial respiration can be done if the calf is not breathing. Normally, the calf should start breathing within the 30 to 60 seconds of time. If possible, let the dam nurse the calf. Basically, the calf has to achieve colostrum intake of 2.5 liters within the first 3 to 6 hours of its life, and should have at least drunk 4 liters within the first 12 hours of its life. If the calf is unable to drink directly from the dam, provide additional colostrum from its mother or another freshly calved cow by using a stomach tube or bottle feeding. In colostrum feeding, 3 cues are very important, which are quick, quality and quantity. Quick means the timing of the first feeding should be right to ensure enough absorption of antibodies into the blood. Quality means there should be good quality of colostrum given. And quantity means the calf should ingest sufficient colostrum so that sufficient amount of antibodies can be transferred to the calf. In this case, it's very important to advise the farmer, since there's many things that can be done to prevent dystocia, and also there's many things that can be done to reduce the effects of dystocia. So it is very important to ask the farmer to contact veterinarians for early intervention in case of dystocia, especially when the cattle have not shown any improvement in the first 30 minutes. Instead of waiting for a whole day for the cow to deliver, early intervention is better because it minimizes the effects of dystocia on the calves. Besides that, proper record keeping on the breeding bull, mating date, pregnancy period and the expected delivery date should be conducted to prepare for efficient parturition process. As for prevention, breeding selection, Hyphen Selection and proper nutrition are viable options to prevent dystocia in cattle. However, breeding selection is the most effective means of preventing dystocia. Selection of a sire can have one of the most dramatic effects on dystocia risk because the sire plays a role in the growth of the fetus genetically and may influence the size and weight of the umbilical cord as well as the placental and umbilical efficiency. Taking into consideration, dystocia is typically caused by fetal dam disparity, where the size of the fetus or fetal birth weight is the single greatest influence on dystocia. It is important to select bulls that produce calves with good birth weights. To help select bulls, we should look at the expected progeny difference, also known as EPDs. Important EPDs to pay attention to are birth weight EPDs and calving ease EPDs. Another strategy to reduce dystocia is selecting sires of smaller stature for breeding. Besides, if artificial insemination is preferred, egg-sorted semen can be utilized to produce female calves which generally have a shorter gestational period and have lighter birth weight compared to male calves. As for Hyphen Selection, they can be selected with the same EPD tools as bulls, but Hyphen's EPDs for females is not very accurate. So it's more important to look at the sire's EPDs so genetic selections of Hyphens can be conducted more efficiently and effectively. An important parameter to look at is the calving ease of maternal EPDs, to know the degree of assistance the bull's daughter will require during its first calving. Besides that, selecting heifers with larger pelvic inlets may not be a good idea. Also, since heifers with bigger pelvic opening tend to have larger calves, which does not reduce the risk of dystocia. It is also recommended for heifers to reach 65% of mature body weight before its first calving, but the number can go as low as 50%. But below that, fertility will suffer and also affect subsequent pregnancy. And as for nutrition during the third trimester, it is important to provide the cows with the right amount of nutrition. Excessive nutrition or nutrition deprivation has shown to cause higher incidence of dystocia. Obviously, when dams are fed with nutrition dense ration, it will produce calf with higher birth weight, which increases the chances of dystocia. It may also cause excessive fat buildup around the pelvic cavity of the dam, which effectively reduces the pelvic inlet size, which increases dystocia risk. However, nutrition deprivation of dams is also not the solution. Dams with lower body constitution score are more likely to have dystocia during calving due to the lack of energy. This is especially true for heifers which have high nutritional requirements. So restricting the nutrition may increase the time required to return to cycle and reduce pregnancy rate. So that's all for my group, and thank you very much for listening to our presentation.